It's a beautiful sunny afternoon in Carmel, California. And as I had a visit this afternoon from a hospice counselor, I thought maybe you'd be interested to know what hospice is and the role that it plays, excuse me, in my life, or more precisely, the amount of life that I have left, which is something that no one knows. No matter how much we pay our doctors for their wonderful advice, they can't tell you how long you're going to live. Anyway, right now my use by date is December 31st. I've had use by dates given to me earlier by my cancer doctors. One of the best was, he said, 3 weeks or 2 months. That was 8 months ago. The more current one was maybe 6 months ago, and came about because the two regimens I've been receiving to treat my RCC, renal cell carcinoma, cancer of the kidney, the only one I have, my right kidney. When they couldn't come up with any other treatments to stop the cancer or slow its departure, they introduced me to something called palliative care, which is a specialty within the cancer profession, so to speak. And it is to prepare a patient for death by focusing on all of the good things that you can do with the time that you have left. And for medical care or medical attention, while you're in this stage where you know you're going to die, you have a rough idea of when it's going to be, and that date is almost always wrong, usually much too soon. There's a concept called hospice, in which you shift your care from all of your specialists just to hospice, which is made up of doctors and nurses and other specialists who focus on patients who are in a terminal stage of cancer. You're eligible for hospice when a doctor is prepared to say that you have 6 months or less to live. There's at least 2 forms of hospice. There's hospice at home, and then there is hospice that is can be in your home, but more often is in a healthcare facility, and largely occurs in the last weeks of your life. So I'm on home hospice. What does that mean? One, it means I no longer go to see my arthritis doctor or my heart doctor or my kidney doctor or whatever other specialty is floating around in my body. And instead, I live at home. I do whatever I am able to do whenever I want to do it, with one caveat. And as my disease progresses, it may reach a point where I'm not able to walk, and so I become bedridden. But until that happens, you sign up for hospice, and a lovely nurse arrives at your home the next day. They don't fool around. She introduces herself She enrolls you in hospice. You sign papers for about 10 minutes. And she tells you that you will be receiving calls from various specialists within the hospice environment, that a nurse will come to your home once every week or every 2 weeks, and they have done that regularly. They take my blood pressure, they check my oxygen, they listen to my heart, they listen to my lungs, they ask me how I feel. I always give them the same answer. I'm tired, and sometimes it's hard for me to breathe. And it turns out that for RCC, renal cell carcinoma, the symptoms of the disease is really fatigue, loss of energy, loss of strength. For renal cell carcinoma, the doctors, when I asked the doctors, how's this going to kill me? They said, it'll happen in your lungs. The MITs, M-I-T-S, the little nits or mits of cancer will end up in your lungs, and it will eventually impact your ability to breathe. When that will happen to me, we have really no idea. All I know is I'm getting a little more tired every month. I'm getting a little weaker every month. I still drive a car. I still go shopping. I still go for walks. I just have less time to do the things that I like to do. And I have to spend more time sleeping to make up for the loss of the fatigue. Otherwise, my life is really quite normal. As the counselor who visited me today observed, while it's impossible to tell when death will occur, she said, hopefully it'll happen sometime when you're asleep. And she said, but we'll never really know. And my attitude is, as long, and I'm in no pain at all. As long as I know what's going on with my body, as long as I can articulate any symptoms that I have, I'm just going to continue to do whatever Mel and I would like to do. And that's pretty much measured by her level of energy or my level of energy. Of late, both of us have had some struggles with in the energy department, but Mel is much recovered now. And so we're starting to engage in social activities, going to a dinner party, or having lunch with friends out, so that we get out of the house and get out and drive around and see things other than the microwave in the kitchen. And if the disease progresses as they think it will progress, I guess there'll come a point in time when my level of energy will really preclude me from driving a car or from going for long walks, when they may decide to bring a hospital bed into the house. I neglected to say that the day after I was enrolled, a nurse arrived at the front door with a wicker basket in her hand. And in that basket was a series of medications, painkillers, things to relieve anxiety. They had to be refrigerated, so a drawer that had previously been devoted to storing vegetables now contains my hospice medications. They're all virgins. They haven't been opened. They haven't been used. I haven't had any need for them. And I trust that that will continue. And I'm going to keep myself as active as I can, uh, both physically and mentally. So that by mentally, I get to have these chats with my family and loves, and then once a week I write an article for Storyworth on some subject of my life that. Particularly those subjects where I can remember things that happened in the family that my children and grandchildren and nieces and nephews might not be aware of. And starting next month, I'm going to help Del Mesa Carmel with the review of proposed amendments to its uh, conditions, CCNRs, conditions, clauses, and restrictions. And I thought that should help keep my mind active. I'm not particularly frightened of dying. I knew it was going to happen sometime. I just didn't know the people were going to tell me within a 6-month range that it was going to happen. And I wasn't ready for them to tell me why and how it was going to happen. But when you're 89, trying to make it to 90, which would be April of 22, I mean, you can't really be pissed off that you've been somehow robbed of years and years of happiness and excitement. I mean, I've had a good life, and so I'm not afraid of dying. I am just my constant complaint, I guess, is that I just have this energy drain, and there isn't anything I can do about it. I don't know they can't give me any medication to bounce my energy back up, although I try scotch now and then. But it's just that I don't know when it's coming, and it's sort of frustrating to just be waiting to die, but not having any particular feelings other than fatigue that would suggest that maybe something was going to happen to you. Of course, I mean, I have to be fair. I have to say that I haven't died before. So I don't know a whole hell of a lot about it. I'm not sure how you're supposed to do it. I'm not sure what you're supposed to say. Well, my friends, that brings me to the end of our chat today. For some of you, it may be a downer. For me, it's just recognizing the ebb and flow of life. And I don't plan on checking out any earlier than I have to, even if it means I have to pay for another day's rent. I'm just gonna keep going, and that's me. And I anticipate that you will be subject to many more sessions listening to me talk about my life, and that soon some of you will say, "Oh, for Christ's sakes, Mac, why did you just get off the planet, for God's sakes?" But I'm not going yet.